So today I want to talk to you about glucose metabolism and specifically the impact on resistance or endurance training and the uh, metabolism of glucose related to skeletal muscle. So first of all, endurance training, when we talk about endurance training, what we're really talking about is aerobic exercise. So this may be like bicycling, walking on a treadmill, using elliptical. Now, resistance training is where we're basically using resistance. So either we're pumping iron, we're using resistance bands, or even your own body weight. Uh, but so, what is the impact this has on your metabolism of glucose? So often when we talk about these things, or when I hear people, come into our facility, they're looking to lose weight, and and obviously these things will help you lose weight, but you can have an appropriate weight and still have issues with your glucose metabolism, such as insulin resistance and things like that. So I want to talk to you about that because often people may lose weight or have a normal or ideal body weight, but there's still things that you need to be concerned to related to kind of your glucose metabolism. So one of those things is as we get older, you start to develop insulin resistance, and so it's estimated really that really by the time you're age 60, about 30% of the population is going to have type 2 diabetes. Well, why is that? The challenge here is traditionally as we age, you're going to develop glucose intolerance and you're going to develop insulin resistance. But it doesn't really have to be that. Now, there's lots of factors here: your age, what's your physical activity, do you have inflammation in your body, what's your body fat composition. There's lots of things with associated with that, or can be contributed to insulin resistance. But one of the big things is your skeletal muscle. Now, as we get older, we tend to lose muscle mass. And the important thing about this is skeletal muscle is really extremely important in the metabolism of glucose and the utilization of your insulin glucose. So there's some things we need to understand that as we get older, why is it important to continue to exercise for our health, but also, not necessarily just for weight loss, but there's certain things that exercise, specifically endurance or resistance exercise, does to your body that's going to help you with your insulin metabolism. So, like I said, as we get older, we tend to have much muscle atrophy. Now, a lot of times, though, people think, it's 50 years old, 60 years old is when we really need to start worrying about that, and that's not the case. Really, you start to lose muscle mass, as early as 25 years of age. So, anything you can do to prevent the loss of this muscle mass is extremely important. Now, by the age 80, approximately 40% of the what's called the vastus lateralis, which is really just a muscle in the thigh, has been lost, meaning that 40% of that muscle mass by the age of 80 is gone. Now, when you talk about the loss of muscle mass, if you look at the literature, most of the literature really talks about it in terms of the adverse effects. So first of all, the loss of muscle mass is termed sarcopenia. That's the fancy term for it, but really what that means is loss of muscle mass. And when you look at the literature, like I said, it really talks about really the adverse effects related to strength and power. And this really leads to loss of mobility, your inability to really perform your daily activities, such as climbing stairs or lifting objects, things like that. But and these are important things and things you want to minimize, and so you don't want to lose muscle because it contributes to this. But it's also important to understand that this loss of muscle mass has a really detrimental effect on your metabolism of glucose. So when you have a reduction in your muscle mass, you're really kind of starting to put yourself in that arena where you're going to have metabolic issues related to glucose metabolism and insulin resistance. So it's important to understand that physical activity and exercise really contributes and helps a lot in preventing or minimizing a lot of things that happen to us as we get older. So, it's obvious that physical activity has been associated with a superior health and enhanced quality of life as we get older. And, really we think that declining physical activity is kind of one of those things that's just part of aging, and it doesn't have to be. Okay. And as we get older, we have kind of that decrease in physical activity. It's really going to have a big effect or an impact on how your body's metabolizing glucose, like I said, and related to your insulin resistance. So it's important to understand that you may appear healthy and at an appropriate weight, but if you're not exercising, it can really have a negative impact on specifically your metabolism of glucose. And then obviously, if you developed insulin resistance or type 2 diabetes, we know of all the consequences. That's not the point of today, is talk about all the bad things that happen when you start to develop those things. But the important thing to understand is that insulin resistance and type 2 diabetes, the consequences of that is immense. And so it's important to do things to maintain it and even improve your muscle mass. So another factor as we get older is we tend to have more inflammatory markers. One of the specific markers I want to talk about is something called the skeletal muscle tumor necrosis factor, or TNF. Okay, and this also contributes to kind of that insulin resistance. So as we age, if you have an increase in inflammatory markers such as the TNF that I talked about, there's other inflammatory markers. This also leads to uh, insulin resistance. Now, the interesting thing about this skeletal muscle tumor necrosis factor is, like I said, it increases with age, but it's also related to impairment of our metabolism of glucose. So if you can do things to reduce this inflammatory marker, it's obviously going to help you metabolize glucose better. And the great thing is the resistance training, or a combination of resistance and endurance training with flexibility training, these have all have shown to decrease this inflammatory marker as we age. So again, exercise is helping us help us metabolize glucose better, but it's also reducing inflammatory markers that also have a negative impact on glucose metabolism. So the important thing to understand is often people are talking about uh, exercise in the context of weight, and it does have an impact on your weight, but it has an impact on a lot of other factors, specifically your metabolism of glucose. This is extremely important, like I said, because we know all the bad consequences of kind of that metabolic syndrome where you aren't metabolizing glucose like you should, and you develop insulin resistance, and all the bad consequences of with that. Now, one of the challenges we have is as we get older, if we're losing muscle mass, we're putting on weight, and then we decide, okay, well, I need to do something about my weight, and so I'm going to start to work on losing weight. And how you do that, though, is extremely important, because if you go just on like a caloric restricted diet, um, you're going to lose weight, but you're going to lose muscle mass. And so you're actually losing one of the components that is extremely important for your health. So if you're trying to lose weight, if you fall into that category that you want to lose weight, you can lose weight, but you want to make sure you're losing the right weight. That's the fat that's within our body, not the muscle mass, because at the end of the day, the loss of weight, regardless if it's muscle or fat, does help in the sense of joint strain and fatigue and things like that. Simple laws of physics say, that you're stressing things, and it doesn't matter if it's a pound of muscle or a pound of fat. But if you're losing muscle, you're losing all that support structure that helps stabilize joints and your core and things like that. So you want to maintain your muscle mass as we age, or improve it. And we also want to maintain or improve it if we're trying to lose weight. Now, the important thing to understand is you can do that. You don't have to lose muscle mass, but it does become somewhat a little more complex than just saying, hey, eat less and move more, because there's lots of factors on what are your macronutrients look like, what the time of day are you eating, what's the timing of your meals, and then what type of exercises are you doing to promote that. So if you're saying I want to lose weight and then you're just doing aerobic exercises, it's going to help promote weight loss, but you're also going to promote muscle mass loss, which, like I said, is not what you want to do. You want to actually improve your muscle mass. You're going to have a more efficient and healthy body. You're probably going to feel better. And the reality of it is, like I said, this can be complex. There's lots of factors affecting this. So really, for today, the take home message is that really adding resistance training is really going to enhance your health and really improve your quality of life. So if you're on your health journey, it's important that you're doing some type of resistance training, and that's going to add quality to what you're doing. In addition to eating healthy and nutritious foods, but you're going to help prevent and even promote muscle gain. So that's extremely important. Uh, like I said, this is a very complex thing. This is just kind of the tip of this iceberg today to kind of get you thinking about this. But like I said, the important thing is if you're, first of all, you need to be exercising. And then secondarily, you need to add some type of resistance training to your exercises. So hopefully you find this helpful. And if there's anything we can do for you, just let us know. Thank you.